your brain gets the full benefit of connection to your spine, and then you are able to control the rest of your body. Describe to me what your problem is, the pain, where you're getting it.
The sciatica, well, my one starts actually from the back, because every now and then I'll feel like a little tingle there.
Center of the back?
Yeah, it's L5, I think. L5.
L5, okay.
Yeah, that's where it starts. I forget the numbers.
That's the bottom vertebrae.
Yeah. And so the pain I feel isn't necessarily there. It's not like a pulsating pain there. It's like a nerve pain that goes down all the way to the
one foot, one leg?
Only the left side.
Only the left?
Yeah.
Okay. What have you done so far to alleviate it? You've been training at the gym to try to build yourself up a bit?
Well, training at the gym is what caused it.
Oh, so, it's what caused it. Okay.
This happened 2 years ago.
Yeah.
And essentially then it happened because of a certain lift that I was doing, and the way I was moving my body, because my hips and my core wasn't tense.
So you actually know what caused it, or you assume?
Well, I know it wasn't one thing that caused it. It was a period of time of me doing lifts, not having my core stabilized, of moving the body the incorrect way.
All right.
So it wasn't like one
have
thing.
you had it diagnosed by a medical professional?
They just call it sciatica.
But they have looked at it and they've...
MRI, yeah.
Yeah, so you've had an MRI and they call it sciatica.
Yeah.
Okay, which virtually means the nerve is being impeded, which causes a trigger, which gives you pain. All right, I'm going to show you very simple, basic exercise. You can do this alongside with me, and we'll just go through it so you familiarise yourself with it. So the preliminary to almost everything I do, almost every exercise that involves me standing upright, is the feet are about shoulder width apart, a comfortable shoulder width apart, and if possible, turn the toes in. But in your case, if it's uncomfortable, don't do it. Just point them straight ahead. Definitely not splayed out. We can't do that, right? It has to be at least straight ahead or pointing in. Now, when we're standing up like this, I've got a set of instructions that you need to follow, and they're all very simple. Is your ear, shoulder, and ankle need to be in line. Now that's without any strain. That's not like lifting your head back or anything else. You're fairly young, so nothing really will have impacted on any of that yet. You won't keep getting bent, droopy back or anything. So it's important. So if you can do that, which you're doing now, it's comfortable. Yeah? Yeah, no problem. Okay, now what I want you to do is imagine that you're being held up by a string, a rope, like a puppet, dangling, and you're just hanging off that. You can either prompt yourself by pulling your head up a bit, or does that feel right? So now your body's dropping away. It's being held up by something at the top.
Yeah.
Feels all right?
Yeah.
Now what I want you to do is very slightly close your sphincter and try to draw it up. Just gently. Okay. Not like, pretty much like you're trying to stop a fart. You're in the lift and you don't want it to happen. That kind of feeling, right? You can just stop it. Doesn't take much.
Yeah.
Okay. Now, you know where your coccyx is? At the bottom of your spine? Put your finger on it if you need to.
Yeah.
Identify it. I want you to imagine that you are turning that under. Now, it can be done. We have very limited control over that particular area of the body. We can only maybe move it 0.5 millimeter with a lot of trouble, but I want you to picture that you're doing it.
Okay.
So we have being held up, your ear, shoulder and ankle in line, feet pointing forward, and I want you to tell me, can you feel your weight on the ground? Are you recognizing that you weigh a certain amount, that in effect feeling gravity, the pull of gravity?
Yes.
Can you feel that?
Yeah.
At all? You have that sensation?
Yeah.
Okay. Now, picture your vertebrae, of which there are, I don't know, 3 different sections and however many. It's irrelevant. And I want you to do, I'll demonstrate first. I want you to do this. Now, I don't expect you're going to have to do it that far in the beginning, because it might aggravate the problem. But what I want you to picture is that from the bottom, you can do it from the top to the bottom, or the bottom from the top, but you already recognize your L5, which is the very lowest vertebrae. So I want you to just slightly turn that.
From there or from my top?
No, I want you to think of your spine as a coiled spring, like the old-fashioned coil.
Yeah.
And when you turn coil from the top and the bottom, it doesn't turn the first one and the second one. What it does, it turns all of them. You realize that? It's a physics thing. So what we're going to try and do is try to get you to turn all the vertebrae at the same time, but we're going to begin in this very beginning stage with recognizing that you can turn not from the hips, but that you can turn with your hips still straight, your feet straight, and you can turn from the vertebrae. Now, it is possible to look completely the opposite direction when you do this. I don't want you to go that far, because it'll put a strain on you in the beginning. So we're trying to do this very, very gently. So at this stage, if we move from the first vertebra, no, see what's happening? You're moving from here. I just want you only to move from here.
From there.
Yeah, it takes some, no, your head's moving. I want you to keep the head pointing forward and just move from here. Only
it's hard not to move without the hips.
That's right. Don't move the hips. You need control.
That it?
Doesn't matter. You don't have to go very far. Okay. Now, the next one.
Oh, that aggravated it.
Stay there.
Yeah.
Go back. Stay there. Move this. Okay. Move this. Move this. Move this. No, not the head. Move this.
Yeah.
Move this. No, leave the head. Move this. So putting a strain on you?
A little bit, yeah.
Okay. Back off. And get back into that sphincter right there again.
Ooh. Yeah.
Don't leave that off.
Okay.
Now what we're trying to do is, in my opinion, the reason that you have some pain somewhere, or nearly always everybody has pain somewhere, not because something's broken, that may or may not happen. It's because your body is objecting to using that part, and it's signaling pain, which is the reason to lay off, right?
That's not,
what we want to do is work around that.
Okay.
So if the pain's coming from one particular vertebra, it is possible to leave that alone and just move from all the other ones.
Okay.
So eventually, if we practice that idea, whatever we do, if we pick up a weight or something, we can isolate the one that's giving us trouble.
Okay.
That makes sense?
Yes.
Okay, so what I'm doing now is exactly what I've told you, and I'm not moving my head, I'm leaving it there, and I'm turning like this. 1 or 2 vertebrae, 3, 4, 5, 6, 7, 8, till I move the top, and then I move the head, which is where the last ones are.
Okay.
Now, that's a sequence, But eventually what we need to do is just move the whole lot on in one go.
Okay. And how will that...
And what that does is get you in contact, this is my take on what's happening. Your brain gets the full benefit of connection to your spine, and then you are able to control the rest of your body.
Okay.
So when you have an injury that you want to heal up, or if you've been diagnosed that it is a definite injury, by using it or not working around it, you're exacerbating it all the time.
Say that again?
Well, by using it, but
yes.
like if you're bending over or doing something and you're contacting in that area,
yes,
you're exacerbating the problem.
Okay.
Now, what you need to do, it's very difficult to what we call ignore it mentally, but if we can work around it, if you have the ability eventually by doing this exercise, this will actually teach you really good control of your spine.
Okay.
So eventually you can either bypass the area that's giving you trouble, or in the very long term strengthen that area.
Okay.
Now the other thing you need to do is relax with it, right? And that's why we're talking about trying to draw up the sphincter a little bit, because it has a relaxing effect on your hips and on your spine. Can you feel that?
Okay. I'll show you. Yeah.
So if you can get into that relaxed state, you don't need to move. It's not a contest of how far you can move. You just need to get into that idea of contacting each vertebrae in your mind. So actually physically understanding that they are able to be manipulated. They're not just a dead lump of bone sitting in the back of your body somewhere. They actually are a very active part of everything you do. So eventually if you want to lift your leg up, it's controlled by that.
By the spine?
Yeah. It's all connected to the spine.
Okay.
Or the arm, or whatever you want to do. Feet come first.
Feet.
Line up the body, the ear with the shoulders, with the ankle.
Yep.
Draw up a little bit of the sphincter. And then imagine the tailbone or the coccyx is at least pointing this way. Not.
Okay.
The reason I say that is because people have no control of this area usually.
Yeah.
They don't think about it much.
Okay. Well, what I'm doing now is like the bare essential exercise which they gave me 2 years ago, which I did to help heal me.
And is this from physiotherapy?
Yeah.
Okay. What's the exercise?
There's the cat-cow where you just on all fours and you just bend the back up and down.
Yeah.
You sit on the chair. And you sort of go here. You sort of stretch the nerve. And on the bed, almost the same thing when you're lying down.
Yeah, okay.
So the bare minimum exercises.
I don't say any of the other stuff not going to help. It's all good. It's all good stuff. But if we try to concentrate and manipulate the spine, we're going to get a quicker and better result. My concept is, regardless of how strong your core is and all the other stuff that people do, to be able to do an exercise or an amount of exercises, if we're not controlling our spine, which is our central nervous system is running through, then we don't really have control of our body.